Spreading like wildfire across this country. It feels like everyone I know has COVID right now. But is it about to ease up? To answer that and other COVID questions, I want to bring in our medical expert, Dr. David Winter from Baylor Scott & White Health. Good morning to you, Dr. Winter. Good to see you.
Good morning, Sonia. Good to be with you.
So I can't believe this. 2 years ago yesterday, the first COVID-19 case in America was diagnosed. The pandemic has since, as we know, undulated. The Omicron surge began 2 months ago and has climbed since then, though it appears now to be peaking in some parts of the country at least. So how are we faring right now with COVID in North Texas?
Well, two answers there, Sonia. First, new cases, they are starting to level off. Now, imagine this. If you're destined to get COVID and get seriously ill, it takes about 2 or 3 weeks from the inception of the disease until you have to go in the hospital. And so indeed, new hospital cases are still continuing to go up. Hospitals are full. Many hospitals I called around this morning are still delaying or postponing their emergency surgery, or their elective surgery rather. Emergencies are still being done, of course. So yeah, we still have a problem. Still lots of cases out there right now, as you said, Sonia.
Dr. Winter, can you go over how this Omicron variant spreads? Because I know some people go, oh, well, I don't think it's that because I don't have a fever, and I don't think it's that because I can still breathe, or I still have my senses of taste and smell.
Yeah, it's different than the previous variant, the Delta. It acts differently. And it sounds a lot like a common cold. Sore throat, stuffy nose, little achy, little fatigue. I've tested a lot of folks, and usually, well, I can tell you 2/3 of the time they have COVID. 1/3 it's a common cold. So they actually are quite similar right now. Fortunately, it's mild for a lot of people, but it's still spread through the air, and it still can be a big problem for folks that have immunocompromised conditions, the elderly, and just some unlucky people also.
What about the vaccines? Are they working against Omicron?
The vaccines definitely are working, and the boosters are working even better. You know, a recent report just came out and said that so if you're age 65 or older and unvaccinated, compared to somebody who has been vaccinated and boosted, if you get sick with COVID, you're unvaccinated, 49 times greater chance of going in the hospital sick. So clearly the vaccines work and the boosters work even better.
Now, what about getting the disease itself? Because we're starting to read and hear more about this. Does that prevent future infection? I mean, I think at this point we know that you can get COVID more than one time, but in terms of antibody protection, what is the research telling us right now?
Yeah, if you get COVID, your body's going to build up resistance, immunity, and that's through antibodies. And that does work. It does work well. However, in comparison to folks who get vaccinated, you're better protected from the vaccine. So if you've gotten COVID, you still want to get the vaccine for maximum protection.
What about people who go, oh, well, maybe I should, or my children should just get COVID, and then at least we know we have a little bit of protection for a while? What do you say to them?
You know, I've heard that, Sonia, and I don't really get that. It doesn't make sense. Sure, most kids are healthy. They do well with it. Some have no symptoms at all. But still, there are kids that get sick, and there have even been some deaths reported. You know, think of it like this. So say there's a neighborhood kid who gets influenza. Are you going to send your kids, say, go get influenza so you can get it over with? You don't do that. And you want to protect yourself from this disease also. We want to try to limit the spread. So no, I don't think we ought to try to get over with by just sending kids around to get the virus. No, not at all.
All right. Dr. David Winter, thank you so much as always. Appreciate your time.
Thank you, Sonia. Have a good weekend.
You too.